Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss a very few important questions from radiology section for your 2025 CPC exam. So the first question is, patient has a frontal lobe brain cancer and physician performs nuclear diagnostic imaging of the brain using small amount of gamma emitting radioactive tracer to examine the function of brain. So 4 static views of the brains are taken. Okay, so 4 static views of the brain are taken. So let's find out the correct answer. So you can see option A is 78605 and option B 78600 and option C and D comes with the units. Okay, since there are 4 static views, you can see the options with units 4. But you need to cross check whether you can go with the units or not. Okay, let's see now. So already explained to. Okay, 78600. 78600 brain imaging less than 4 static views. 78601 brain imaging less than 4 static views with vascular flow. So you can easily eliminate 78600, that is option B and option D. Okay, these two are incorrect because these codes comes with less than 4 static views, but in our question they performed 4 static views. Okay, so now you have to check between option A and C. 78605 says brain imaging minimum 4 static views. So this CPT is correct. Okay, 78605 is correct. We have minimum of 4 static views. So the code description says here minimum 4 static views. That means you should meet minimum of 4 views. Okay, even if you are meeting more than 4 static views, you still select 78605. Okay, all you have to need is minimum of 4 views to select this 78605. And if you get 3 views, 2 views or 3 views, you can go with 78600 code. Okay, and this intended codes are for the documentation where they perform with vascular flow. But in our question, there is no documentation regarding vascular flow. So the correct answer is 78605. Okay, option A is correct for this scenario, and you cannot select option C 78605 with units 4 because there is no need of giving units here. The primary code itself says minimum of 4 static views, so the code single code is enough and no need of units here. So option A is correct. Next question, patient has swelling in both arms and lymphangitis is suspected. She is in the outpatient radiology department for lymphangiography of the both arms. Okay, so they have performed lymphangiography procedure. So as you all know, lymphangiography, it's an imaging technique. They'll perform to visualize the lymphatic system, mainly to examine lymph vessels and lymph nodes. Okay, utilizing contrast dye material, they'll perform the angiography procedure, and they'll check for any kind of lymphatic tumors or inflammation or maybe lymph edema. Okay, edema is like swelling due to some fluid. Okay, so that for those purpose they'll perform lymphangiography procedure. So here it is itis, that means it's an inflammation. That's why they are performing lymphangiography procedure. So we'll see the correct answer now. So option 75803, 75801 are there. So here is the lymph angiography procedure. 75801 lymph angiography extremity only unilateral, and 75803 lymph angiography extremity only bilateral. Okay, so we have unilateral code and bilateral code. So in our question, lymph angiography they have performed for both the arms. Okay, that means it's a bilateral procedure. Okay, so you can eliminate option A and B directly because in the CPT code itself has this bilateral criteria. Okay, so you don't have to utilize 50 modifier here. The mainly 75803 has the code description says bilateral. So for this 75803, you cannot use 50 modifier. Okay, and next other options include 75801 and 75803. So 75801 says extremity unilateral, 75803 bilateral. Okay, so the correct answer is 75803, and it also includes radiologic supervision and interpretation. So the correct answer for the second question is 75803. Okay. So next question. So next question, patient in the radiology facility has an X-ray examination of her entire spine after falling down the stairs and experiencing peripheral paresthesia. The radiologist takes a total of 8 views of the lumbar spine and thoracic spine and cervical spine, including atlas and axis and base of the skull. Okay, so including all this area, they have taken 8 total views. Okay, so X-ray, and we will see what is the 8-view radiologic code for this scenario. So we have option 72020, 72084, 72114, 72081 with units 8. So you can see spine and pelvis, radiologic examination of spine and pelvis are there. Under this, you have to check for all the location. So if you come to 72081, here the code includes radiologic examination of spine, entire thoracic and lumbar, including skull, cervical and sacral spine. Okay, so everything is included here, but they are taking only one view. Only one view is there in the standalone code, and in the intended codes 72082 says 2 to 3 views, 72083 says 4 to 5 views, and 72084 says minimum of 6 views. Okay, minimum. To code 72084, at least you should get minimum of 6 views, then only you can select 72084. So the meaning of this particular code is, if you get minimum 6 view or more than 6 view, you will select 72084. Okay, so in our question, the total views are 8 views. Okay, so for 8 views, including all this area, okay, so the correct answer would be option B, 72084. Okay, so once again, you can see the description of 72084. So here is the code description. 72084 says radiologic examination of spine, entire thoracic and lumbar, including skull, cervical and sacral spine, if performed, minimum of 6 views. Okay, so answer is 72084. Option B is correct. Next question. Patient is having X-ray imaging of his abdomen following a traumatic episode, and then for the abdomen, a decubitus and supine and erect view are performed on the abdomen. Okay, so on the abdomen region, they are performing X-ray. So here they have mentioned the view also. Okay, so like different position, they have taken X-ray with the different position. Say for example, here supine means like patient will lie flat on their back, and same way erect view means patient will stand upright, right? The patient is standing and then they are taking abdomen X-ray, that is erect position. And lastly, decubitus. Decubitus means patient lies on their side. Okay, one side, there will be like maybe left side decubitus view or right side decubitus view. So which side they are, they are what to say, on the mainly patient, which side that patient is turning, that will be considered as a decubitus view. Okay, so 3 positions they have taken. So let's see the answer also. So on abdomen location, so you can see 74018 abdomen examination, one view. Okay, radiologic examination of abdomen, one view. 74019 is for two views. 74021 is three or more views. Okay, so they have not specified any position here. In these three code, they are only saying how many views they have taken, but they have not specified the position, that how they are going to take the X-ray on abdomen. But coming to 74022, this says radiologic examination of complete acute abdomen series including two or more views of the abdomen. Example, supine, erect, and decubitus. Okay, single view and single view of chest also. This include single view chest also. So since we have all these three positions, the correct answer is 74022. Okay, so you can see option 74022 is correct. Okay, and 26 modifier we will be coding for professional component. Okay, for since this question is incomplete here, if the question says how do you bill for profi or how do you bill for a provider, you should utilize 26 modifier. Okay, most of the time radiologist, the providers will be like profi providers, professional providers. So we will be utilizing 26 modifier with that to report their professional service. Okay, option D is correct for this particular question. So there are more questions are there still. I'll try to cover in next video, or if you have exam like this month, last 2 days back, one batch CPC exam preparation March batch completed. Okay, I have posted the feedback also in Instagram. I have posted, you can check there. And new batch I'm not starting immediately because I do have some other work. So I'll be starting in April end. Okay, so in middle you have examination and you want preparation, you can join for recorded sessions. Okay, you can message me, need like saying that you need recording class and also some important material, so I can provide that. Okay, but live classes will start from 27th maybe. Okay, I'll see when I can start, and then I'll post the details of the course next batch. Okay, so that's all guys for today. And if you have not watched the other videos, like I keep covering all few important questions for your examination, so please do support and subscribe to my channel. And if you are watching me newly, so please visit my bio so that you'll get complete information about me, what I do, where I work, everything I have mentioned in my profile, so you can check there. And also WhatsApp number will be there. So in WhatsApp, you have to send me a detailed message so that I will respond. But if you directly call, I cannot pick the call. But if you're messaging me through WhatsApp, I'll definitely respond. Okay, so that's all. Thank you for watching. And as I mentioned, please do share with your friends and please do subscribe to my channel. Okay, and maybe day after tomorrow, I will try to cover pathology and laboratory section also. So let's finish up this CPT portion as soon as possible. Okay, thank you all.